inward movement. It is a paradoxical movement. This is a Hoover sign. Hoover. Hoover sign. There is another Hoover sign is there in the leg, but it is a Hoover sign. Paradoxically inward movement of the lower ribs, mostly the lower ribs. Okay, mostly the
lower ribs.
अरे mostly the क्या है? देखा नहीं है? देखा तूने? इधर
बस इंटरकोस्टल
देखा तूने? इधर दिखा मेरे को दिखा कहाँ हो रहा है? अब आटे श्वास लो. इधर हो रहा है देख पीछे जा रहा है.
intercostal muscle movement.
बोलो.
I'm asking, that movement is the intercostal muscle movement or rib movement?
Intercostal space. Recession of the intercostal. Recession. Retraction of the intercostal. Why? Why is this happen? Because the respiratory muscles are weak right now. Respiratory muscle is weak. That's why the expiratory muscles are intercostal muscles. They are engaging to help the inspiration or expiration. Okay? The paradoxically, as sometimes the in COPD patient or any lung pneumonia condition, post pneumonia, the consolidation is also occurred. Consolidation. So that area also push. Consolidation always a push. ये push नहीं, pull. खींचता है. क्योंकि the consolidation मतलब सिकुड़ रहा है, तो खींचेगा. That area, that's why the recession is there. The two position is two